welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler. Tyler wears many hats. The two most important one is CEO, and then second, of course, is co-host on the Quick Hits podcast. Tyler, welcome.
That's right. Thank you, Ken.
Yeah, good to chat with you. How are things going this week?
You know, it's sort of springtime in New York, and it feels like travel is back. Was just out at class in Utah last week, and excited about the upcoming travel, especially with HIMSS, which I know we'll get into in a little bit. But yeah, feeling that spring vibe, and nice to be in Q2 of 23.
Excellent. You know, here in the Pacific Northwest, I don't think spring exists anymore, but we'll see. But hopefully soon. Well, cool. And yeah, hopefully we'll have another chat at some later point about class, because I'd love to kind of hear what you discussed there in Utah. This week we are joined by Karla and Brandon. So Karla has recently been promoted. She is now the VP of Signature Services. And Karla, that includes software development, integration, and data migration, correct?
That's right. I'm a big deal.
You are, absolutely. There's no question on that. And then Brandon, you are the VP of Foundation Services, and that includes apps, advisory, and PMO. Is that correct?
That's correct.
Oh, awesome. Now, I think it should be noted that both of you were promoted after being on the Quick Hits podcast last year. So I don't want to take credit for it.
Could be related. Could be related. Thank you for that, Ken.
You know, I do what I can. I'm just trying to give back. That's all. So it's awesome. So, you know, before we talk about what signature services and what foundation services are, I kind of wanted to talk conferences just a little bit. Karla, you just got back from Vive. Can you tell us a little bit about that? What were some of the highlights, or what was the buzz at Vive, and where was it?
Sure. Vive was in Nashville this year, which is such a cool town if you've never been there. I heard a lot of people calling it Nash Vegas. So,
absolutely.
You know, a lot of fun music on every corner. This is the first time I've been to Vive, and I'd never been to Health before. And of course, the same people put on both events. But the production value on Vive was amazing, you guys. They had a recording studio. You could record a song. They had a hair salon inside the conference. A puppy park. I mean,
I did see the puppy park pictures. Yeah, that was impressive.
You don't ever need to go to another conference. It was cool, though. The production value was really nice. I heard a lot of people remark about how modern it is, and it's smaller than a conference like HIMSS, so you get to interact more directly with people. I feel like it's a lot more casual environment. They had great food, and you could sit down to lunch and, you know, just meet, a lot of new people. So the venue and the production were great. The attendees seemed pretty varied. There was healthcare, provider organizations, lots of exhibitors that were startups or really companies on the cusp, the innovative cusp there, trying to do some really cool things with technology and healthcare. Some of the trends, AI right now, obviously, is on everybody's mind. So lots of companies that are doing AI or in the, kind of AI adjacent space. Mm-hmm. A lot of interest in analytics still, of course. Mm-hmm. Everybody wants to know how they're doing and what they can change. And then behavioral health. I saw actually quite a few behavioral health things going on there, which was pretty cool. It's about time for that.
Excellent. Now, how big like you said, it was a little bit smaller than HIMSS, but I mean, like how big would you say it was?
Yeah, I don't know how many people, but you could walk through it in one day. Okay. Where I feel like HIMSS, you need several days.
Yeah, you need two days minimum for HIMSS. Agreed.
Yeah.
And that's if you don't talk to anybody. So.
Right. Yeah.
Excellent. Yeah. Cool. Well, and speaking of HIMSS, so we're looking forward to HIMSS. That's coming up here the week of April the 17th, which is HIMSS is always exciting. This year it's in Chicago. So I don't know who all is going to HIMSS this year.
We're all going.
Yeah, everybody. We're taking everybody.
Oh, okay.
And I guess, all our senior leaders, a lot of our sales team will be there. And then we're taking a few additional resources that just have real strong presence in the industry, and will get a lot of value out of the conference for themselves personally, and be able to add value for the company.
Excellent. Yeah,
it'll be a fun group.
Very cool. Well, awesome.
And then we also have a happy hour that we're doing on Tuesday, April 18th.
Listen, don't show up to happy hour unless you don't want to have like a skee ball competition going, because it's at a beer. Dude, it's at a beercade. It's at a beercade.
Oh man, dude, now I have to come.
I'm throwing down the challenge right now. Yep.
That's awesome. Yeah, so that is April the 18th for that HIMSS happy hour. So excellent. And I guess we'll.
Oh, hey, the happy hour we're co-hosting with Health Catalyst. They're a big deal, right? It's going to be really cool. And then we're also partnering with both the North California and Southern California HIMSS chapters.
Oh, excellent. So, okay.
Yeah. Good.
Yeah.
Good.
And huge kudos to Karla. She's been running point from the HDM side, but also generally point for the entire event, as HDM's really been leading it. So thanks again, Karla, for all the work on that.
Very nice.
I can't call that. Really, Jackie Ramirez has done a lot of it too. So kudos to her.
Nice. Mm-hmm. Excellent. Well, good. Always exciting. I know HIMSS, usually we come back with a few additional contacts, and, there's always good talks. I'm curious this year what some of the AI-focused talks will be, because I remember in Orlando, was it last year, there were some pretty interesting talks when it came to AI in healthcare, and just kind of the concern that some people have. And I'm curious how those concerns will be presented this year, because that's definitely something on a lot of people's minds. So, yeah, awesome. Please take notes, and we look forward to doing a post-HIMSS breakdown and getting some additional information.
Sure.
So, you've heard us talk about signature services. You've heard us talk about foundation services, and throughout the company, that's definitely those are buzzwords that we've heard a lot more of recently. So, Tyler, if you could help set the stage on what our strategy is and how we determined that these are the names of those services and how they became a pillar of HDM.
Sure, and I think that we've talked a bit about the HDM house that we flash, where we show the roof, the mission, and the vision, and then the bones and the structure of the house is our signature services and our foundation services. So congrats again to Karla and Brandon for promotions over these two critical categorizations of our core services, and I'll let them speak more in depth to the differences between what signature works on and what foundation works on. But most importantly, we lead with signature services because we believe that the innovation and the work that we can really do to differentiate HDM from the rest of the market is done in our signature services. Data migration, integration, software development. But at the same time, we have to have excellent, best-in-class foundation services. And so our application work, whether it's Epic applications or ERP applications, needs to be top-notch. Our PMO practice needs to be the go-to for organizations that need to build a PMO, that need expert project managers. And our advisory, also needs to be excellent. So the success of both are tied together. And while we are going to lead more with signature services, the bet we're making is that if we lead with signature services, the foundation services work will follow. And if we provide excellent foundation services, then signature services work will be tacked on. So I'll kick it over to Karla to talk more about the actual nuance of signature. But really excited to be talking more with Karla and Brandon about this pivotal, not directional change, but clarity and direction for HDM.
Yeah, I like that. Yeah, it does provide clarity. Thanks for that, Tyler. Yeah, Karla, please explain a little bit more in detail signature services and how important that is.
Yeah, what I would say, so again, signature services for HDM include software development, integration, and data migration. And what I would say about what makes that signature and what makes HDM really unique, I've been in this industry a long time, 25 plus years. And, I've worked as a consultant. I've worked for the provider orgs. I think what makes us really special is we marry signature services and our foundation services applications, and the PMO and the advisory. So we know the clinical and operational workflows, and we combine that with this true technological expertise. So we're able to create these really cool, unique solutions that work for the end users. And that's the point, right?
Yeah, absolutely. That makes a lot of sense. So then how does that set the stage for foundation services?
Well, foundation services are a part of everything we do, and that's what makes them foundation. So, we work in the healthcare technology space. So, we can't create solutions, or there would be no point to create solutions that didn't work for our end users. And so that's where the operational and workflow expertise comes in, that we have, the army of consultants that are out in the field day in and day out implementing and optimizing and upgrading the EMRs of the world. And Brandon will talk a lot more about that, but that's such critical knowledge. And then to marry that with project management skills, the PMO suite that Brandon manages, to be able to implement these projects really skillfully, keep them on time and on budget is so important. So we make a great team, Brandon and I.
Yeah. Brandon, do you want to kind of add anything to that when it comes to your viewpoint on signature services?
For sure. I mean, we see foundation as a complement to our signature services, right? Like Karla said, without foundation, there probably won't be signature, and we work hand in hand. So really glad to, have this structure where we can really just support each other in our endeavors.
So let's talk a little bit about some of the challenges that you face in your respective side of the house. So, Brandon, what are some of the challenges what are some of the challenges that face organizations that you're working with first? So that's the first question. And then the second question, what are some of the challenges that we face in trying to assist health organizations?
Yeah, no, good question. So I think, the biggest challenge we're probably seeing across the board, and many of us, we get updates from Beckers and whatnot. We also hear firsthand from our clients, organizations are in a tough financial place right now, right? It's like after COVID, there was, they're in this recovery process, and now no one's really on track to hit their numbers for revenue this coming year. So a lot of organizations are taking strides and, trying to cut back on, what's not going to increase volume, what's not going to bring in revenue, to focus on, projects and work that will help keep them out of the red. So I know we're seeing that across the board, and that's probably, how that challenges us is, a lot of times it's they're not looking to staff your typical projects or optimizations, or whatnot. Now they're very strategic in what they're going to fund now, and what kind of people to bring in. So I feel like it's a little more specialized in what they're looking for. So I mean, case in point, I think, we've just added and started doing some project management services in the operational excellence arena, right? So I think that's the first time we've did that. Most of our project management work has really been in the healthcare IT space. So that's just showing they're looking at a lot of affordability initiatives and whatnot, and they need help with that. So it's really us being able to flex and adapt to our clients' needs and what they're looking at. Again, big things that they're facing, right? I mean, if volume is down, they're not bringing in revenue. It's because, it's something, there's something broken in their patient flow process, right? How do we get more people admitted? How do we get more people into surgeries and so forth? The other thing is I think there's just also stigma with patients since COVID and actually going into the doctor and whatnot. But now it's let's look at access. Let's make sure we can we make access to our clinics, to our doctors, to our hospital and services much easier for the patient. So they're really also looking at, patient experience. So it's just a different shift, kind of not what we're used to in the past. Probably also to add on, we talked a lot about AI and data, right? That's huge now. Mm-hmm. Everywhere is data rich, information poor. So how are they going to take this data to build efficiencies to increase revenue? So that's overall, I really think that is really where most organizations are at right now.
So if we could just go back for just a second, you did mention that COVID negatively impacted their budgets and the bottom line. How exactly is that? Was it due to the reduction in available services? I know some places weren't doing elective surgeries, et cetera. Is that what has led to that, or was there more to it?
For sure, a multitude. So that's one thing, right? So probably a lot of places are playing catch up, right? All of that lost volume from surgeries and whatnot, which is a big money maker for organizations. So that's one thing. The next thing you have to consider is there's most likely labor shortage, right? There's nursing burnout. So all of these organizations are spending a lot of money on expensive contract travel nurses. So a lot of money is going there as well. So it's just kind of that domino effect. And it looks like, everyone's really still in that recovery phase, trying to get back to where they were pre-COVID.
Any predictions on how long that will last?
I would say another year.
Another year.
But it could go on to 2. But that's just my opinion. Not sure if Karla has a different opinion there.
I'm not sure we'll ever go back. I think COVID has changed so much about healthcare and the way we have to think about the delivery of healthcare. Telehealth really boomed with COVID. And so I think we're going to see more and more organizations are hungry for technology and innovation. Like Brandon said, though, budgets are tight, so it's hard to roll that stuff out. They're being really judicious about what technologies they're selecting to implement, but all of those really with a mind for the things Brandon called out: nursing shortages, provider burnout, patient engagement, and things like that.
So, sorry, did I interrupt someone?
Nope.
Okay. Yeah, Karla, so thanks for chiming in. So from a software dev perspective, what can we do to help with burnout, do you think? Or is that something that we can help companies address, or is that something that other organizations have even reached out about?
Yeah, there's a lot of things. People are, we hear a lot of organizations looking for the clinic of the future, the hospital of the future. Mm-hmm. And a lot of that, those plans, those strategies include incorporating technologies that take some of the burden off of the clinical staff. So eliminating some of the things, that they do so that they can focus on the things technology can't do. Some of the intake stuff. How many times have you gone to a doctor's office and had to fill out the same forms multiple times? And, different people in the office ask you the same questions. Let's eliminate some of that stuff. And, there are technologies now that will, you could look at a screen and it takes your blood pressure. And, let's take some of those tasks out of the hands of those skilled professionals and let them do what they really do best, which is take care of patients. Yeah.
Gotcha.
Right. Patients, accessibility to these tests, number one. Number two, it's streamlining all this data to make it easier for all, everyone who's giving care. But not only, now with all this data, it's also, it's like there's work to be done to make this data available and digestible for everyone.
Actionable.
Outside of, for everyone in that institution, for the whole ecosystem.
Yeah, actionable. And that's where, you asked about what we're doing for our customers. We work with healthcare provider orgs, but we have a pretty significant market in the digital health and biotech space, as well as life sciences. Companies are coming up with these amazing solutions that solve a lot of these problems, but they don't do any good if they're not where the clinicians and end users can use them, which is in the EMR, and when they use them, which is normally real time. So that's what we're seeing a lot of right now, doing a lot of really custom complex EMR integration pulling data out of the EMR where, companies can use it to run their analytics, run their AI on it, and send back insights that clinicians can use that help mitigate some of that burnout that's happening.
Yeah.
And a lot of the startup companies, or even these larger existing companies already, right? They want to take advantage of this, and they're trying to come up with products to help these organizations out. But what they're missing is that middleman, right? Like kind of that integrator, that translator. And I find in my work with clients that that's typically always kind of the roadblock, or where they see the most issues. So it's, I feel like that's also a great opportunity for HDM and Karla's team.
Yeah, that's a good point. Is we a lot of them have a backlog of implementations. The customers are hungry for what they do, but they don't have enough resources to roll them out. They're also very cognizant of the financial burdens that are placed on the healthcare organizations. So these third-party vendors, they're trying to eliminate some of that by supplying the resources needed to do the implementation on the client side for them. So we're seeing a lot of that that kind of customer rollout implementation work coming from third-party vendors as well.
Interesting. I guess so that is a lot of opportunity for us. And just in terms of partnerships, I've seen some short-term, hey, can you guys help us implement this, like the adaptive project, where they eventually want to take it over. But I feel like there's a lot more value in a long-term relationship. Would you agree? Because the expertise isn't necessarily there with the life science company or with that third party. And like you said, the organization's they can't spare a resource. So really, we're looking for those long-term partnerships, right?
Yeah, but I think adaptive is one of those. We're doing their their Epic Aura implementation to streamline orders and results, from the EMR, Epic EMR, to their lab. But we're not just doing that implementation for them. We're also helping them connect to other EMRs, augmenting their teams that are managing technologies like Mirth. We're going to be with Adaptive for a long time.
Excellent. Glad to hear that. Good. So, Tyler, you've got a question. You just came off.
I inadvertently hit my pen against a cup, and it sounded like a bell ring. So I guess it is my chance to. Yeah. So look, I love the way that Karla paints a symbiotic relationship between Signature and Foundation, and I feel like it's something I've tried to relay before, but I'm so glad this is recorded, because I think that is probably the best way to explain how these two service lines play together. And then, wrote down immediately Brandon's statement, data rich, information poor, which is then I think what Karla was also expounding upon with actionable. And so it's so nice to really hear it exactly from the folks on the ground. And I hope I don't take us away from where we're going. But, one of the things I'm curious too, it seems like, we're learning as we go through this post-COVID world. And like Karla, you pointed out, like a lot of these things are here to stay. It's a different world, and there's going to have to be some of these changes, or some changes are going to have to come from technology, because we don't have enough labor, and it's not going to just suddenly be fixed. But curious to you all both, as you've stepped up and taken over ownership of these two teams. What are some things you've learned about yourselves as you've become leaders of these two distinct service lines?
I've learned that I don't need sleep. Does that count? I can go an entire night without sleeping. I don't know, Brandon, what have you learned? That'd be interesting.
I honestly, what I'm learning is, as these things hit, we realize there's solutions for them, right? So I feel like this is making us realize we know more than we ever thought, and we know how to put the pieces together, and we understand this entire ecosystem, right? And how to make things better. So for me, that's been kind of enlightening on my end.
Yeah, that's a good one. That is a good one. I think, there's just no bounds to what we can't do. We take on these really tough challenges that a lot of people are afraid of, and we overcome them. So, I mean, I think that's something I always knew. I've been around HDM long enough to know that, but it happens every day here. You see us overcome these crazy challenges, and it's really cool to see how the team rallies.
Absolutely. Yeah, it seems like we're always learning a new technology, always learning a new platform, and and not just learning it, but excelling at it. So
yeah, you got that right.
What are some projects you guys are excitedly working on right now? We'll start with Brandon.
One of them is building a new hospital, and I'm leading the experience design team. So really, we're evaluating and doing user research on everyone's pain points for the different teams in the hospital, and figuring out and recommending potential solutions that's going to help, technology solutions, right? And it's some might be blue sky, but this hospital's opening in 2030, so it's really trying to figure out where are we going to be in 7 years, and what do we think we can, we have a high probability of implementing and integrating to give the best experiences to staff, patients, and learners. The other thing that I think, kind of hits home kind of where we're at right now when we speak about revenue and organizations trying to recoup and do better, and so they don't redline. A lot of everywhere is looking into throughput, right? Regardless of where it is, inpatient, hospital, ambulatory, they're looking for throughput. Getting patients in, getting patients out, let's make room for everyone. So the other thing I'm working on is, we just launched a patient capacity management center, which is really looking at patient flow for all of adult services for several hospitals of this organization. And we're already seeing tremendous improvement in KPIs, decrease in LOS, and capacity, actually making space and room for patients who need the care. And you're looking at, organizations now, they want to, next phase would be want to expand it. Let's look at how our affiliates are doing, how can we work with them to get, to let them create capacity. Let's take in their patients who need higher level care and so forth. So it's been pretty awesome and pretty cool to see. And like I said, it's all going back to data, AI, predictive analytics. So it's all super all in an effort to really, bottom line. I mean, a lot of these places are looking at revenue, right? So how are we going to get there?
I like how you just casually dropped that you're helping build a hospital. That's pretty awesome. You'll invite us to the ribbon cutting of your wing of that hospital, correct? So. Karla, what about you? What's going on cool in Signature Services world?
I can't pick a. Isn't that like telling one of your kids they're your favorite? I can't do that. I like all my projects, all my customers, my teams. We're just doing really fun work. Like I said, the integration work is hot and heavy right now, and it's always so varied. So, and in some cases we're connecting companies that are doing work in the research study area. Sometimes it's in the chronic care management space. It's just so varied. Population health, obviously with Epic Aura, there's a lot of genomic labs, and that's getting really important critical cancer tests in the hands of clinicians for their patients, so they get more timely care. It's just critical, and
absolutely,
it's fun to be a part of that.
Now, Epic Aura, was that featured at Vive at all? Was there any discussion of that? No. Okay.
No, it's pretty new. I think we'll see a lot. If anybody goes to UGM this year, you'll see a lot of it there. I think there's only 5 or 6 labs that are live right now on Aura, several of which we've helped, which has been fun.
Nice.
But we're going to see a lot more of it it's definitely gonna grow. There's a lot of healthcare organizations. Ultimately, it makes integration a lot easier. They don't have to stand up those point-to-point interfaces. So on the provider side, it's a game changer.
Yeah.
And we're hearing some of them say, they only want to work with those labs that are live on Aura.
Oh, wow. Mm-hmm. Mel and Janaik actually had a really good conversation that Mel typed out for us, and that is available on the website for anybody that kind of wants to get an idea of what Aura, Epic Aura, is all about.
Yeah, actually, that article isn't really about Aura necessarily, but it's about how much simpler the technology is to implement. So Janaik, he's got a lot of great point-to-point HL7 experience, but now he's done several Aura projects, and he can tell you firsthand how much easier it is to integrate those labs through the Aura network. So that's what that article is about, and it's kind of a different spin. It's a pretty good read.
Yeah, absolutely. Excellent. Well, this is a great conversation. I guess if there's any takeaways, it's that everyone at HDM really should be focusing on how we impact either signature or foundation. And I think the cool thing is to hear of how important they are to each other. So it's not two different sides. I mean, it's kind of, like Tyler's house analogy, right? You need walls on both sides of your house. So, that's very cool. Tyler, anything you want to add into this discussion?
No, I think that it's amazing to learn more through talking with Karla and Brandon about the actual work that we're doing. I also, another observation I had, just in Karla talking about Janaik and Mel, and I know that Brandon on his side has been building out more of a team, with Jacqueline and Caitlin and Steve Newcomb and others that have been joining full-time the HDM ranks. The build-out of our HDM internal team is happening, and it's happening because we have excellent leaders like Karla and Brandon who folks want to learn from and work with. And so it's really nice to see as the house gets bigger, if you will, and we add more floors or whatever analogy you want to make, we add more rooms, and that's a direct impact from what Brandon and Karla are able to do. So definitely huge appreciation for all the work that they do day in and day out. Hopefully Karla optimizes for some sleep. But in the hours that she's not sleeping, she's doing an amazing job. So I just, couldn't be more grateful for the alignment behind the mission, vision, and values, and then actually carrying it out on a day-to-day basis.
Yeah,
Tyler.
Absolutely. Yeah. Well, thank you so much, Karla and Brandon, and of course Tyler. Thank you so much for taking some time out of your busy day to chat here on Quick Hits. So just a quick reminder again, the week of April the 17th, HDM in Chicago. I'm sorry, HIMSS. HDM is at HIMSS in Chicago. There we go.
No, but we will be the conference.
Yes, exactly. It is the HDM conference.
Did we tell you the happy hours at a beer cave? Oh yeah, I did. I threw
you
down.
Did.
The
Look,
right. We'll do that again.
We'll talk later about my plane ticket, but
okay.
No, this is awesome. So always enjoy the conversation. Karla, Brandon, I look forward to whatever promotion you get after this episode drops.
Thanks, Ken.
But hey, all right, thanks a lot, guys, and we'll see you on the next episode of Quick Hits.